A client states that her husband gets angry and throws objects but never hits me. She denies fear but avoids discussing details. The social worker's first action is to A. Provide psychoeducation on anger patterns. B. Conduct a lethality and safety assessment. C. Explore communication skills. D. Encourage couples counseling. Answer: B. Property destruction is a significant predictor of escalating IPV. A lethality assessment must come before education or relationship interventions. A social worker suspects a colleague is falsifying client progress notes. What should the social worker do first? A. Report to the state board. B. Discuss concerns directly with the colleague. C. Report immediately to agency administration. D. Document observations and gather objective facts. Answer: D. Ethical obligations require factual evidence before initiating confrontation or reporting. Documentation ensures accuracy and avoids premature accusations. A teenage client discloses chronic sadness and isolation but rejects therapy involvement. The most appropriate next step is A. Suggest an antidepressant evaluation. B. Explore the meaning behind rejecting therapy. C. Encourage participation in family sessions. D. Refer to a skills-based group. Answer: B. Exploring resistance uncovers ambivalence and hidden motivations. Understanding refusal is essential before offering interventions or referrals. A client with PTSD describes nightly flashbacks and panic attacks. The social worker's most appropriate immediate intervention is to A. Begin trauma narrative work. B. Teach grounding techniques. C. Explore childhood history. D. Suggest EMDR referral. Answer: B. Stabilization and present moment safety precede trauma processing. Grounding reduces dissociation and prevents overwhelming emotional arousal. A mandated client minimizes substance use but reports losing employment and custody. The priority action is to A. Administer a standardized addiction screening. B. Confront inconsistencies directly. C. Refer to inpatient treatment. D. Gather collateral information from family. Answer: A. Objective screening helps clarify severity and guides treatment decisions. Confrontation without assessment may heighten resistance. A parent reports a 7-year-old is too clingy after the sudden death of a grandparent. The best initial intervention is A. Begin grief processing art activities. B. Normalize developmental responses to loss. C. Suggest family therapy. D. Encourage independence through structured tasks. Answer: B. Children often respond to death with clinginess. Normalization reduces parental anxiety and creates readiness for later interventions. A social worker receives a subpoena for a client's psychotherapy records. The first action is to A. Release the records immediately. B. Inform the court that records are confidential. C. Contact the client to review options. D. Request the judge to quash the subpoena. Answer: C. Subpoenas do not automatically require disclosure. The client must be consulted to determine consent or legal direction before responding. A client with borderline traits alternates between idealizing and devaluing the therapist. The most appropriate response is to A. Set firmer consequences for emotional outbursts. B. Process how these reactions relate to attachment patterns. C. Shorten session length for structure. D. Shift to solution-focused techniques. Answer: B. Exploring relational patterns helps reduce splitting and increases insight. It stabilizes therapy more effectively than punitive limits. A client expresses suicidal thoughts but denies a plan. The social worker should A. Develop a collaborative safety plan. B. involve family immediately. C. Arrange for hospitalization. D. Increase session frequency only. Answer: A. Without plan or intent, outpatient safety planning is standard. It enhances coping and identifies emergency steps while maintaining autonomy. During a family session, a father dominates conversations and dismisses others' opinions. The first intervention is to A. Explore power dynamics. B. Redirect discussion and set communication rules. C. Conduct separate sessions. D. Discuss cultural views on hierarchy. Answer: B. Structure is needed before deeper exploration. Establishing balanced communication ensures safety for all members to participate. A client shows pressured speech, racing thoughts, and decreased sleep for 1 week. The priority differential question is: A. Family history of mood disorders. B. Sleep hygiene routine. C. Recent traumatic events. D. Use of stimulants or illicit substances. Answer: D. Substance use can mimic mania and drastically alters treatment pathways. Ruling out substances prevents misdiagnosis. A client who recently immigrated describes spiritual visions during prayer that guide daily decisions. The most appropriate social work response is: A. Diagnose psychosis. B. Explore cultural and spiritual meaning. C. Refer for psychiatric evaluation. D. Teach reality testing skills. Answer: B. Cultural humility requires assessing whether experiences align with cultural norms. Pathologizing prematurely risks harm and misdiagnosis. A social worker notices countertransference when a client's behavior resembles a past abuser. The most appropriate action is: A. Share the feelings with the client. B. End sessions temporarily. C. Seek supervision to process reactions. D. Ignore the feelings to maintain boundaries. Answer: C. Supervision helps evaluate countertransference and prevent it from affecting care. Ignoring feelings risks unethical decision-making. A client with severe anxiety refuses to leave home. The most suitable first intervention is: A. Address avoidance by exploring fears. B. Initiate exposure hierarchy development. C. Begin cognitive restructuring. D. Refer to psychiatrist for benzodiazepines. Answer: A. Understanding the fear's meaning improves therapeutic alliance and readiness. Exposure or medication decisions follow conceptual clarity. A client reveals intention to physically harm a coworker but refuses to discuss details. The social worker must: A. Maintain confidentiality. B. Warn the coworker directly. C. Notify authorities and follow duty to protect laws. D. Ask the client to write a safety contract. Answer: C. Credible threats toward identifiable individuals require legally mandated protective action. Confidentiality is overridden by safety concerns. A foster youth repeatedly sabotages placements and says, "I won't stay anywhere." The most effective intervention is: A. Focus on problem-solving future behaviors. B. Explore trauma around attachment ruptures. C. Increase behavioral reward systems. D. Refer for anger management therapy. Answer: B. Placement sabotage often reflects trauma-driven attachment insecurity. Addressing loss and mistrust builds stability and reduces acting out. A client with chronic pain pressures the social worker to support disability benefits despite inconsistent medical evidence. The most ethical response is: A. Decline involvement in documentation. B. Provide honest assessment based on available evidence. C. Write the letter to maintain rapport. D. Refer the client to a new provider. Answer: B. Social workers must provide objective documentation. Advocacy must not compromise professional integrity or misrepresent facts. A client with an eating disorder reports strict daily rituals to stay in control. The most clinically relevant response is: A. Encourage journaling. B. Teach nutrition education first. C. Suggest eliminating all rituals immediately. D. Explore emotional function of the rituals. Answer: D. Understanding the underlying function guides effective treatment. Removing rituals abruptly increases distress and resistance. A client with complex trauma dissociates during a session. The first action is to: A. Continue processing trauma. B. Use grounding strategies to reorient. C. Ask about childhood neglect. D. End the session immediately. Answer: B. Grounding re-establishes presence and safety. Continuing trauma work while dissociated risks re-traumatization. A court-mandated client with anger issues states, "I only came because I'll get in trouble if I don't." The social worker should first: A. Explore how the mandate impacts motivation. B. Begin teaching anger management techniques. C. Start with a cognitive behavioral worksheet. D. Clarify legal consequences. Answer: A. Exploring ambivalence helps build intrinsic motivation, a critical factor in mandated treatment engagement. A client expresses hearing voices but states they are pleasant and comforting. The priority question is: A. Do the voices ever command you to do things? B. When did the voices start? C. How often do you hear them? D. Do they sound like someone you know? Answer: A. Command hallucinations significantly increase risk of harm. Safety assessment supersedes symptom detail gathering. A terminally ill client says, "I'm just a burden to everyone." The most therapeutic response is: A. You should focus on staying positive. B. Tell me more about what makes you feel like a burden. C. Your family doesn't feel that way. D. Would you like spiritual counseling? Answer: B. Empathic exploration validates emotional pain and uncovers deeper meaning. Minimizing or redirecting invalidates the client. A client with OCD spends 3 hours daily checking locks. The first treatment focus is: A. Challenge obsessive beliefs. B. Begin exposure and response prevention. C. Explore family history. D. Teach meditation. Answer: B. ERP is the gold standard first-line intervention. It reduces compulsions by breaking the anxiety relief loop. A social worker suspects elder financial abuse by a caregiver. The worker's legal requirement is to: A. Gather more proof before acting. B. Increase visits and observe behavior. C. Confront the caregiver. D. Report suspected abuse to authorities. Answer: D. Mandated reporting laws require reporting suspicion, not proof, to protect vulnerable adults from harm. A client with major depression reports sudden increased energy after starting medication. The priority is to evaluate: A. Sleep pattern changes. B. Risk for suicide. C. Weight changes. D. Medication adherence. Answer: B. Increased energy before mood improvement can enable suicide attempts. Safety assessment becomes the top clinical priority.